Swayam Prabha. Digital India. Educated India.
Welcome to the course Nutrition for the Family. This is the fourth module, that is nutritional care for females during physiological stress, that is pregnancy and lactation phase. And in this first lecture, we shall be focusing on the physiological changes during pregnancy. I am Dr. Jaspreet Kaur, presently working as Associate Professor in Government College for Girls, Ludhiana, Punjab, affiliated to Punjab University, Chandigarh, and this project is funded by DTH Swayamprabha, MHRD, New Delhi. In this lecture, we shall be studying about the nutritional needs and nutritional care of the pregnant woman. And in this first lecture, we will study what are the physiological changes which happen during pregnancy, and then we will see what is the effect of these physiological changes on the nutritional status and the nutritional needs of expecting mother and her fetus. And lastly, we will study about the developmental stages of pregnancy. Adequate nutrition before and during the pregnancy, it has a huge potential for the long-term health benefits for the mother and her child. Maternal health, it is a big complex which is influenced by many factors such as genetic factors, then social and economical factors of the family. And there are some other conditions such as infections or some environmental conditions. And many of these things, they affect the fetal growth. And along with that, there are a host of changes which occur during this phase. So let's study about various physiological changes during the phase of pregnancy. Pregnancy, it is a period of great physiological stress for the woman as she is nurturing a growing fetus in her body. And this fetal development, it is accompanied by many physiological, biochemical, and hormonal changes which occur in the maternal body, which influence the needs of nutrients and the efficiency with which the body is going to use them. So this results in many adaptations inside mother's body. So the physiological adaptations, they result either in improved utilization of nutrients or through there will be increased absorption of certain nutrients, there will be decreased excretion of certain nutrients, or there will be some alterations in the metabolism. Due to fetal growth and development, there is increase in the basal metabolic rate, which increases, say, about 5% in the first trimester of the pregnancy, and it can reach as high as 12% during the later stages of the pregnancy when the rate of the fetal growth is very high. The basal metabolism, it is the energy needed to carry out our involuntary activities of our body. So during pregnancy, this rate of utilization of energy, it increases, which needs different increased requirement of energy. There is altered gastrointestinal function during the pregnancy. First thing is the acid secretion, that is a hydrochloric acid in the stomach, and then along with that the pepsin secretion inside the stomach, that is reduced, and the increased progesterone secretion, that is a hormone which causes decreased tone of motility of the smooth muscles of gastrointestinal tract. It will be relaxing those muscles and it leads to esophageal regurgitation. So the food will move upwards and decreased emptying time of the stomach will happen. So the mother will feel as if she is not digesting the food well. And reverse peristalsis can occur, and which leads to sensation of heartburn and vomiting in the pregnant woman. And along with that, this becomes more pronounced with the increasing pressure of the fetus in the late pregnancy. The intestinal motility is also diminished due to various hormones, and the intestinal secretions also, they are reduced. And it has been observed that the pregnant woman often shows craving for some foods and aversion can be felt to some kind of foods. And some women, they even have cravings for some abnormal substances such as clay or starch, etc. And this habit is known as pica. And in late pregnancy, the efficiency of absorption of certain nutrients, it gets enhanced, and such as iron, vitamin B12, calcium, they are increased with great efficiency, which is a natural mechanism of adaptation to meet the increased need of mother's body. Let's talk about various hormonal changes happening during this phase. During pregnancy, progesterone and estrogen, they are the two major hormones which affect the physiology of mother. So there is increased secretion of progesterone, that is a hormone which relaxes the uterine muscles to allow expansion with the fetal growth, and it inhibits the contraction of the uterus muscles layers, and it prevents the expulsion of the embryo before the time comes. And the gastrointestinal tract motility also diminishes, as we have seen in the previous slide. This is to allow the increased absorption of nutrients. This often results in constipation because the muscles of the intestines, they have relaxed, so the peristaltic movement will be affected. And additionally, a relaxed lower esophageal sphincter, it can cause the regurgitation and heartburns also. And this also induces maternal fat deposition, and it increases the renal sodium excretion. The secretion of estrogen, it is lower than that of progesterone during the early months of pregnancy, but it increases after the 100 days of gestation, that is after the conception and the fertilization has happened. So the estrogen and progesterone, they stimulate the mammary glands, and they also inhibit lactogenic function of the pituitary gland. That means the production of milk is halted until the birth of the infant. So along with these hormones which prepare the maternal body to allow the fetus to develop, and there are some other hormones also which affects the nutritional needs of the woman. So let us see what are these hormones. The first hormone is aldosterone, which is also known as salt conserving hormone by the adrenal gland, and growth hormone, which is secreted by the pituitary glands, and along with that thyroxine, which is secreted by the thyroid gland, which regulates the metabolism in the body. And there is also increased uptake of iodide by this thyroid gland during pregnancy. And along with that, there is parathormone, which is secreted by the parathyroid gland, which regulates the calcium, phosphorus, and it aids in the magnesium metabolism also. There are certain changes in the body fluids inside mother's body. By the end of pregnancy, there is an increase in the blood volume by near 40%. Now, why does this change happens? This happens to enable the circulation of large amount of blood, and the capacity of heart to pump the blood, it is increased by 33%. And the increased amount of blood, it is needed to carry the nutrients to the fetus and pick up the metabolic waste away from the fetus. And with increase in the blood volume, more nutrients, they are carried by the fluids which are available to the fetus through placenta. And in addition to increase in the fluid within the circulatory system, there will be higher amount of water in the intracellular water. That means the water which is present in between the cells. And let us talk about the blood composition now. With increase in the blood volume, which we have seen in the previous slide, the concentration of the plasma proteins, hemoglobin and other blood constituents is lowered. There will be dilution of the cells which are present inside the blood. The hemoglobin level of around 12 to 13 grams per 100 ml of the blood of healthy non-pregnant women, it drops to around 11 grams per 100 ml of blood. So despite there is increase in the total hemoglobin, but as the overall volume has increased, this will result in dilution of the contents. This is known as hemodilution. So during the pregnancy, the woman who has hemoglobin level below 11 grams per 100 ml, they are considered anemic. So what are the changes happening to the renal function in the pregnant woman? As we know, there is increased production of various metabolites such as creatinine, urea, and other waste products due to higher basal metabolic rate and growth of the fetus. So, to facilitate this clearance, the rate of blood through the kidneys it is increased, with subsequent increase in the rate of glomerulofiltration in the nephrons. Nephrons, they are the functioning units of our kidney which are performing that filtration function, which are needed to produce the urine to get rid of all the waste products, either they are protein waste products or the other metabolites of the basal metabolism. And any loss of nutrients through the urine, it is prevented by an increase in the ability of the kidneys to reabsorb the nutrients from the filtered blood. And the ability to excrete water, it is also lowered. And edema in the legs and ankles, it is commonly found in the pregnant woman and it is considered normal. And what happens to the breast tissues and the fat stores inside the mother? The progesterone and estrogen hormones, they promote the growth of mammary glands of the breast. The stroma of the breast, it increases in the quantity and large amount of fat, it is laid down in it. And adipose tissues, they accumulate most rapidly during the mid-pregnancy. The maximum accumulation of body fat, it occurs in the abdominal region, in the subscapular region and in the thigh areas. Subscapular region is the area in our upper back. The nature of weight gain during pregnancy, it is an important point which should be considered. This gain is due to gain of both her tissues and the fetal tissues. The appropriate weight gain during the pregnancy, it correlates closely with the infant birth weight, which indicates the health and the subsequent development of the infant. And the gain in weight, it varies widely, which is somewhat more in the young woman than those who are little older and greater in those women who are having their first babies, primigravida mothers. And there are a number of other factors which affect the weight gain, that is the diet, the physical activity, and certain habits such as smoking. All these factors, they affect the weight gain in the pregnant woman. This total weight gain, it includes the weight of full-term fetus, then increase in the size of the uterus which is holding the baby, then the placenta and the breast tissues of mother, accumulation of amniotic fluid which protects the baby from the injuries and keeps it safe, then expansion of blood volume is there, and the fat reserves, they are laid in the body. And along with that, additional maternal stores, they also contribute towards the total weight gain of the mother. And then some extra adipose fat tissues, they are also required for the rapid fetal growth during the later half of the pregnancy, for the labor delivery, and then for maintaining the lactation. Mother needs to have good stores of fat, and this contributes towards the total body weight. The weight of the woman who has gained around 8 to 10 kgs during the first trimester only, she should not be held to restrict her weight to the 9 and 10 kgs, which is the average weight gain, as the major growth of the fetus that happens during the later part of the pregnancy. We have just studied that the pregnancy is a period with a number of physiological and hormonal changes. And the development of the fetus and the maternal organs, they actually take place at various rates, and it is not a uniform change. So during pregnancy that comprises of 280 days, there will be certain changes which are occurring in the pregnancy, which can be studied as different developmental stages. Now let us see how we can study them under different categories. These development stages, they can be divided into three stages. So let us study all these three stages. The first stage is known as blastogenic stage. The first 2 weeks of the gestation, that means that after the time of conception till the 2 weeks, it is the period of implantation, during which the fertilized ovum, it is implanted in the walls of uterus of the mother, and there is rapid cell proliferation. That means the number of cells, increases at a very fast pace, and the placenta, it begins to develop in this stage. The poor nutritional status of the mother, it can be one of the factors which results in the pregnancy failure at this stage. So this is a very, very important stage when it comes to sustenance of the pregnancy. The second stage, it is known as organogenesis. As the name suggests, it is genesis, that means production of hormones. So after 2 weeks, that was blastogenic stage, it is followed by organogenesis. This is the next 6 weeks of embryo's life, and the developing fetus, it undergoes differentiation into its functional units now. So what is happening? The growing cells, they are dividing certain roles. Which part of the embryo will create brain, or which part will create some hands or feet, so different organs. So there will be differentiation, and that is why it is known as period of organogenesis. During this period, the nourishment which is obtained from the blood and the degenerating cells which is there in the space between the embryo and the maternal tissues. So the cells or the embryo, they are thriving on the nutrition from that space only. But formation of individual organs and the skeleton, it starts beginning in the organogenesis. So the presence or absence of specific nutrients, they may be really crucial for the continued growth of the normal fetus. The nutritional inadequacy, particularly during this period, it can result in a number of serious abnormalities. We call them congenital abnormalities in the fetus. And along with that, because this period coincides with a period when the mother is experiencing nausea. So the nausea during the early pregnancy, it can depress the appetite of the mother. When the mother is not eating enough, that means the dietary intake has reduced. So the supply of the nutrient will be reduced to the fetus also. So the nutritional status And the dietary habits before the pregnancy, it can actually help the mother to withstand this period of low intake and can safeguard the nutrients to the fetus. So this is followed by the third phase, that third developmental stage. It is known as stage of growth. And during this stage, these differentiated tissues, they continue to grow until they reach a functional size which is capable of supporting extrauterine life. That means the baby is fit to lead a independent life outside mother's body. So the requirement of nutrients during this time, they are very high. So the needs are more, both in terms of quality and in terms of quantity. And if there are nutritional deficiencies during this period, they will result in the premature delivery or the low birth weight of the babies. Now these conditions, they are not as serious as if the nutritional deficiency is there in the first two stages, where we have seen this could either terminate the pregnancy or it could cause some congenital defects. So any nutritional deficiencies, they have, the effect is there, but it is not as serious as it happens in blastogenic or organogenesis phase. So let's study all these three phases with the help of these images. So this is the first image which tells us about the first growth stage, that is the blastogenesis. That is the stage when there are lots of cells, they are growing in the number. And this is followed by organogenesis, where the formation of organs, it started, and the cells, they start differentiating into different parts of the body. And this is followed by the third and the last phase, which prepares the fetus for extrauterine life. That means the life outside mother's body. And what happens to the cell growth? In the first phase, the growth takes place only by increase in the number of cells. That is replication of cells. It takes place, which is known as hyperplasia. And this is known as increase in number of cell. And this increase in number of cell, it requires folic acid and vitamin B12. And both these vitamins, they play an important role in the synthesis of nucleic acid. So what happens in the second phase when the organogenesis is happening? The new cells, they continue to be formed. That is the proliferation that continues. But the ones which have already been formed, now they begin to increase in the size. This process is known as hypertrophy. And this requires amino acids and vitamin B6, both of which are needed for the synthesis of body proteins. This is followed by the final phase when we saw the growth phase. Here, the cell division, it actually slows down. That means the increase in number, it is halted or it is slowed down. But what is increasing? The size of the cell, that starts increasing. So that means the hyperplasia is reducing, but the hypertrophy is going on continuously. So what is the relationship between the maternal diet and the cell growth? As we have just studied that the growth happens in different stages, where first stages when the number of the cell that increases, we call it hyperplasia. And after that, hyperplasia is accompanied by increase in the cell size. We call it hypertrophy. And towards the end of the pregnancy, we studied that the size of the cell, that is the determining factor. So what happens when the diet is inadequate during the critical period of cell division, that means the hyperplasia. So it can actually depress the total number of cells which were destined to be made. Now, once this damage has occurred, it cannot be undone, and we cannot correct this deficiency by taking adequate diet at some later stage. However, inadequacy of diet during the cell growth, when the cells are majorly growing in the size, that can be overcome by the adequate nutrition during the later stages. So in a way we can say the effect of malnutrition on the cell number is considered permanent, whereas on the cell size is considered reversible. By the full term of pregnancy, the gain in weight for a healthy woman with desirable body weight, it should be around 10 to 12 kilograms. However, it will depend upon a number of factors. The weight of the full-term fetus, and then increased size of uterus, the placenta, the breast tissue, accumulation of amniotic fluid, expansion of blood volume, and the fat reserves which are laid in the maternal body, which accounts for the gain in the total body weight by the mother. At a gestational age of 25 weeks, the growth increment or the weight gain is just 6 grams in a day. And by 34 weeks, it is estimated to be at, say, 40 grams daily. And by the term, it drops again to the 13 grams daily. So the weight gain rate that varies according to the trimesters. And the pattern of weight gain, which we have just seen, it is as important as the total weight gain during the pregnancy. So during the first trimester, there's little or no increase in weight. So the range, say, is 0.7 to 1.4 kilograms. But after that, steady gain of, say, around 0.35 to zero point 0.4 kilogram per week, it is considered desirable weight gain. In case of obese women who are undergoing pregnancy, restriction of the calorie intake to maintain the weight, it is not considered desirable, as the correction of obesity during the pregnancy has a greater risk on the fetal growth. So and along with that, the excessive weight gain during the pregnancy, it can be due to accumulation of fluid or excess fat or both fat or fluid. And in addition to these factors, insufficient food intake, both in the quantity and in the quality, it will affect both mother and the fetal nutrition. So let's summarize what we have studied in this lecture so far. We have studied that the fetal development, it is accompanied by many physiological, biochemical and hormonal changes which are occurring in the maternal body, which influence the needs of nutrients and the efficiency with which the body is going to use them, and this leads to many adaptations also. Then we studied that these physiological adaptations, they can result in either improved utilization of nutrients through increased absorption or through decreased excretion or some alterations in the metabolism. Then we studied about important physiological changes. We studied that the basal metabolic rate changes, the GIT functions, gastrointestinal tract functions, that changes, and there are changes in certain hormones, the blood composition changes, the renal function is changing, and the fat deposits and the growth of maternal tissue and the fetal tissue, that also changes. And then we studied about the developmental stages during the pregnancy, in which we studied about the 3 stages. In the first stage is blastogenic phase, and then we studied about the second stage, that is organogenesis, and followed by the final growth stage. And then we studied about the effect of maternal diet on the cell division and its effect on cell number and cell size. So this finishes our today's lecture. We shall continue this topic further in the coming lectures. Thank you very much.